First, though, the most recent statistics: 2,262 positive cases were reported yesterday, 11.5% of all tests conducted. 917 people are currently in hospital with COVID, 15 more than yesterday. 59 people are receiving intensive care, 2 more than yesterday. And sadly, a further 20 deaths have been reported over the past 24 hours. That takes the total number of deaths registered under this daily definition to 9,072. Once again, I want to send my condolences to everyone who has lost a loved one. More positively, the vaccination programme continues to make good progress, and I'll provide more details on the booster programme later. However, at this stage, I will confirm that 4,309,932 people have received a first dose, 3,897,133 have had both doses. In total, 87% of the over 18 population is now fully vaccinated with 2 doses. This includes 96% of the over 40s, 76% of 30 to 39-year-olds and 67% of 18 to 29-year-olds. In addition, 75% of 16 and 17-year-olds and 53% of 12 to 15-year-olds have had a first dose, and of course, for most people in these age groups, only a single dose is recommended at this stage. This weekly update coincides with the latest 3-week review point for the remaining regulations, and so I can confirm, as indicated a moment ago, that at our meeting today, the Cabinet agreed to make no change to the current regulations that are in place. This reflects our assessment that, although the situation has greatly improved since August, it does remain fragile as we head into the winter period. In addition, I can confirm today that a further £482 million is being allocated to the NHS and to integration authorities. This includes more than £120 million to support Test and Protect, more than £130 million also to support further the vaccination programme. The balance of funding will cover additional COVID-related costs such as staffing and equipment. The pressures on the NHS are a reminder that Covid is still a threat to our individual health and also to the capacity of our health and care services. Now, I mentioned earlier that 53% of 12 to 15-year-olds have now received their first jab, and I want to sincerely thank all of those young people who have come forward for vaccination. I can confirm that everyone in that age group has now had an appointment scheduled and should have received a letter telling them about their appointment. And I would again encourage all 12 to 15-year-olds not already vaccinated and their parents and carers to read the online information about vaccination so that they can take an informed decision about getting the jab. And if you haven't come forward yet, please do so as soon as possible. Fully vaccinated travellers returning from non-red list countries are currently required to take a PCR test on day 2 of their arrival back to or into Scotland. The UK Government announced recently that travellers arriving into England will be able to take a lateral flow test with photo verification instead of a PCR test. For practical reasons, the Scottish Government will align with this change. That means from 4 a.m. on Sunday, 31st October, people travelling to Scotland can also provide a lateral flow test rather than a PCR test on day 2 of their arrival. The hosting of COP would always have been a significant challenge given the scale of the event for the UK and Scottish governments and for Glasgow City Council. However, the fact that it is happening amidst a global pandemic obviously makes it even more challenging. And it is inevitably the case that an event of this scale poses a risk of increased COVID transmission. However, I want to assure Parliament and the public that the Scottish Government has been working closely with the United Nations and the UK Government to mitigate these risks as far as possible.